it's all for this virus, COVID-19. So for those people who are believers, perhaps, in the government's approach, okay, fair enough. But I'll just say this. What about the infected blood scandal? There are tens of thousands of Australians, okay, in the 20th century that were given contaminated blood transfusions. Why are they not listed anywhere? Why is it that there's never been an investigation, a legal investigation? They've happened in every other country in the world. Why is it that our public broadcaster refuses to investigate? Why are we living under this medical tyranny, believing that it's all about a virus, when they know there's thousands of people who've got Hep C? They won't admit to it. They won't speak about it. You know, Sue, they won't even tell the public that anyone who's been transfused before, say, the late 90s should go and get tested for hepatitis C. And yet they're doing this to us. What do you think, Sue?
Well, I think the interesting thing with COVID is there's a number of issues that I'd like to raise. One is the COVID tracing and, you know, the COVID check-in, the QR codes. You know, basically most modern, to be very few people that don't have a modern phone with, you know, smartphone technology. So we're being tracked regardless by Google and whoever else. Our phones are monitored and tracked, okay? And that's a given. The second thing is we don't need QR codes if that's happening. And the third thing is, with all the lockdown, and I know you in Sydney are still in lockdown and we've just come out of it here, or tomorrow night we're coming out of lockdown, but we are allowed to go shopping in a supermarket, provided we wear a mask, okay? You go into any major supermarket, there could be 100 people in there. Now, you're not allowed to go and visit. I know a lot of people live at single households, you know, but you're not allowed to go and visit an 84-year-old neighbour who's on his own, you know, and take him a meal or keep him company for an hour, or, you know, so on. Yet I can drive him to medical appointments, you know. So to me, the mental health effects of these rules in this lockdown and in this COVID situation are absolutely geared towards isolating people and families, and that has a massive effect on everyone's social and community interactions. And, you know, if you could tell me that if I go out and my likelihood of catching COVID at the moment is, you know, X%, that's, you know, that's something that I would take on board, and I would make a decision for my health and my family's health, you know, whether I wanted to go out and not have a vaccine or not be masked or so on. But the fact is, they play with the numbers so carefully that, you know, it's not until we're nearly 18 months into this pandemic where they're actually releasing data from a year ago that shows that most people that have died of COVID are elderly with comorbidity problems. So it's not the COVID that takes them, it's something else that they've had already. The COVID's just an exacerbated issue. So for me, we've had far more suicides since lockdown than we've had COVID deaths, and it just doesn't get reported, you know. If that's not a medical emergency, I don't know what is.
I absolutely, that's like something out of a horror film, what's happening around. And this hepatitis C, this was in the blood supply right throughout the 20th century. Okay, and we know, we can prove that authorities around the world, they did the wrong thing. Okay, authorities in Canada did the wrong thing. It was exposed by a legal inquiry. Ireland the same, and now the UK by this inquiry, the infected blood inquiry in the UK. But here in Australia, no one knows because the government is engaged in cover-up.
We've got people who are seriously ill, you know, would not get a job today based on their health because they can't maintain a regular sleep pattern. They can't, you know, concentrate. They have, you know, brain fog and all that sort of stuff. Plus other physical issues related to their conditions, not just the Hep C. And if you've had Hep C and you've been treated and it's cleared through your system, well and good, but that's not the be all and end all. You're left, many people, and I would say nearly 100%, I'll take a guess, that nearly 100% of people who have had Hep C and had it cleared through their system, through treatment, now have 1, 2, 3 or 4 other issues that some of them completely left field, out of the blue issues, like, you know, an anaphylaxis to an unknown cause, you know, like that. If people our age can think back to Bryce Courtenay, the Australian author, and his book April Fool's Day, which was written in memory of his beloved son, Damon, who was a haemophiliac, who was given infected blood and died at a very young age. I can't recall. I think it was maybe 24 or something. Really sad, very young age. Now, people out there probably think, oh, well, that's all done and dusted 30 years ago. You know, whoever got hurt got compensation. They would have sued. This is what we're thinking. Okay, the average person in Australia thinks, okay, those people who were the victims of a crime or negligence, there's an avenue, a legal recourse to sue and get compensation, okay, for the injury suffered. However, that's not the case for most contaminated blood victims. We have been left high and dry, okay? And as individuals who are ill, you're told to then go and find the evidence yourself. You know, you're barely able to get out of bed. You know, you mightn't even be able to walk to the letterbox. You know, you're that sick. So you're then told to go and find the evidence yourself and launch a court case.